All right, so again, thank you all for being here today. This is the Careers in Maternal Health workshop session. Yeah, so hello again, and my name is Siani Antoine. I am a second year MPH student at UNC Chapel Hill, and I have the wonderful pleasure of working with the Maternal Health Learning and Innovation Center this summer. And I'm so glad to be here to moderate today's panel. Thank you all for joining our workshop. And today's presentation will be an open panel format focusing on careers in maternal health. And this discussion is targeted for students, early career professionals, and those who are new to the field of maternal health. So we're hoping that this panel will offer you insight into the field and the variety of professional opportunities to support birthing individuals through health equity. And today's panel format, just to give you all an idea, we'll start with directed questions for the panelists, and they will move into an open Q&A. So throughout today's session, if you hear something that you're interested in the panelists talking more about, please feel free to drop those questions in the chat. We have someone monitoring the chat, and then at the end with the Q&A, we'll get to it get to as many questions as we can. And yeah, so without further ado, let's meet our esteemed panelists today. So our first panelist is Abby Cannon. Can you do a little wave for us, Abby? Thanks. So Abby Cannon is the evaluation manager at the Maternal Health Learning and Innovation Center at the Gillian School of Global Public Health, which is housed at UNC Chapel Hill. She brings over 10 years of experience in monitoring and evaluation, with the focus on merging qualitative and quantitative data to share the full picture of a program with stakeholders, funders, and practitioners. She specializes in developing and implementing evaluation plans, using data for decision-making and translating results into actionable steps. And prior to the MHLIC, Abby focused on advancing gender equality on a global health monitoring, evaluation, and research project at UNC. She received both her MPH in maternal and child health and her master's in social work at UNC. And she loved UNC so much that she's still here with us. So that's really great. And yeah, thank you, Abby, for being here. So next we have Kelli Sheppard, which can you also wave your hand if you don't mind, just so people can. So Kelli Sheppard joined the Maternal Health Learning and Innovation Center team in late September of 2020 as the communications manager. She is proud to contribute to the overall improvement of maternal health in some way, shape, or form, so that other women and people who give birth do not have to go through the same ordeals that others had before them. She has 20 years of marketing and communications experience working with nonprofits and small businesses. And she has worked with internationally and nationally recognized organizations, garnered credits as a photographer, a journalist, and cinematographer, a producer, an editor, and a director. So Kelli has worn many hats. She earned her BSBA in marketing and also a BS in communications from Western Carolina. Thank you, Kelli, for being here. And last but not least is Alyson Northrup. And Alyson Northrup is an associate director. Oh, thank you. For the Public Policy and Government Affairs at the Association of Maternal and Child Health Programs, also known as AMCHIP. In this role, she executes AMCHIP's policy activities, including advocating for Title V Maternal and Child Health Service Block Grant funding and promoting AMCHIP's federal policy agenda and representing AMCHIP in various policy coalitions. Ms. Northrup serves as a policy core co-lead for the Maternal Health Learning and Innovation Center. And prior to joining AMCHIP, Ms. Northrup served as a legislative assistant to U.S. Senator Kristen Gillibrand. Ms. Northrup was responsible for managing the senator's legislative portfolio for healthcare, child welfare, and education issues. And she holds a Master's of Science degree from the University at Albany State University of New York and a Bachelor's of Arts degree from Fordham University. Thank you, Alyson, for participating with us today. So as you've heard from the range of careers, we have an evaluation manager today with us, a communications manager, and a public policy and government affairs director. So we're going to be learning about a huge range and unique careers that you can find in maternal health. So again, thank you all for being here today, and we look forward to our discussion. So again, just as a reminder, I'll be dropping questions in the chat so everyone can follow along. And yeah, let's get started. I'm gonna come off of the presentation mode so that we can all see each other. All right, great. All right, so for our first question, please tell us about your path to maternal health, So give us like an education, background, early career, what led you to the field essentially. Whoever would like to go can unmute and just start talking whenever you're ready.
So I'm going to volunteer that we go in the order that you introduced us. So I nominate Abby to go first.
Okay. Siani, I also wonder if since we have a fairly small group, if people would be interested in just introducing themselves in the chat. Would be fun to see where you all are joining us from, and if you're a student or if you're early career, anything you want to tell us about yourself would be fun to see as well. So thanks for that kind introduction and for hosting us today, Siani. And I can get started. So yes, my name's Abby, and I'm the evaluation manager for MHLIC, and I've been in this role for about 1.5 years now. MHLIC is pretty new itself, has only been around for 2 years. And how did I get into maternal health? I studied psychology in undergrad. My path to maternal health, I feel like many folks' path is very winding and circuitous and not a straight shot, at least for me. My first job out of undergrad was working at a nonprofit that worked with children in the foster care and adoption system. So not totally maternal health, but child welfare and maternal health adjacent. I really loved that job, and I loved working with the kids and the babies and that were in foster care with the families. And I think I did that for a couple of years, and it was really rewarding and interesting, also very tough. And it really helped me to realize that I wanted skills and training to be able to do more to prevent children from going into foster care to begin with, and or if they were in foster care, to be able to provide them with more services to succeed in life. And so that was when I decided to go back to graduate school and pursued my MSW. Was my forethought was the social work degree, and then UNC actually offers a dual degree with public health. And so that dual degree is in the maternal child health department. So I did my dual degree with MCH and my MSW, and that was just a fantastic combination to learn about both of those systems and how they fit together, and how we can sort of try to address at an individual and more systemic level. So that was my start into MCH, and then from there I was also very interested in gender equality issues. And so my first job out of graduate school was working more on gender equality, women's health issues in a internationally focused monitoring evaluation project. So I took a monitoring evaluation class in graduate school, and I thought, oh, this is really interesting. It's important to evaluate and monitor what you're doing and look at the evidence and know what you're doing is working. I didn't really see myself as this is my calling, my career, but it has become my career. So I did the monitoring evaluation, and then the gender equality interest piece was what drew me to my first job. And then I sort of became more steeped in the importance and the value of monitoring and evaluation and being able to evaluate programs. And so that was sort of what I did for a while. And then after, I guess about almost 4 years ago now, I had a baby, and he came I had preeclampsia, and he came really early through an emergency C-section, and we were in the NICU for a little over 3 months. And so that once again brought it back home to me of why maternal health is so important. And so I had already been working in evaluation that did some work with MCH, but it wasn't totally focused on maternal health. And so that was where I sort of also transitioned a little bit more to be able to work directly in the field to try to, as Kelli said, to prevent that kind of experience from happening to others and be able to provide support. And the way that I do that is through evaluation. So I kind of help with MHLIC to track what we're doing, and are we doing what we said we're going to do, and how can we improve our services and our support and our technical assistance. So that's my circuitous route, and I will hand it off then. I think Kelly was next on the slides.
Hi, everyone. I'm Kelli Sheppard, and I'm the communications manager for Maternal Health Learning and Innovation Center. And as my background, honestly, I kind of fell into it. So after graduating college in 2006, I pretty much had a hard time finding a job there was like a recession at the time. So I ended up in customer service, and I decided to make my own way, so to speak. So I did a lot of freelance work on the side with other small businesses who are up and coming. And I apologize, my now 2-year-old is right next to me. But after after having a couple of customer service positions, I started working at March of Dimes in 2011 as a temp, doing data entry, and then I transitioned into a permanent position as their state administrative assistant. And it was actually one of the my managers there that liked my work design-wise, because believe it or not, administration kind of calls for some design knowledge. And so it helped me because I already had that training. I had already been implementing. And so at March of Dimes, I became their communications coordinator for their North Carolina Preconception Health Campaign. And I did that from about 2013 until 2020. And then last year, I joined UNC's team for the Maternal Health Learning and Innovation Center as communications manager. I've grown to really appreciate all the work and effort that's going into maternal health. And honestly, I'll give you a little backstory, but part of my drive for this type of work, I became a mother in 2018. I had a negative experience. None of the doctors or nurses listened to me. My child was literally in my canal, okay? And I'm yelling at them, I need help. Someone, she's coming, and no one listened, okay? That's the short version of that story. But so anything that I can do with my knowledge and my background career-wise that I can do to help drive maternal health into a more positive atmosphere, for lack of a better word, I'm gonna do it. Oh, the end, sorry, Alyson.
Thanks, Kelli. So hi, everybody. I'm Alyson Northrup. And as Siani mentioned, I work at AMCHIP, the Association of Maternal and Child Health Programs, and I work in government affairs. And that I love my job. I love where I have ended up. It is not the career that I envisioned for myself. I don't know that I had like a grand plan, but to be honest, I don't think I even knew that my job existed. So like Abby and like Kelli, my path has been one of lots of twists and turns and exploring and being pulled or identifying interesting opportunities that come up and just kind of feeling my way into what feels right for my interests. And that started in undergrad. I studied, the major was international political economy, kind of like international relations. And like many bright, young, shiny, undergrads, I wanted to do good and be a positive force for change in the world. And so I, after undergrad, worked for a statewide economic justice organization, and that was focused on state politics, actually. And it was a good fit, but it was, I found myself being drawn towards more of health. And so I toyed with the idea of post-bac medical school, or I remember looking at a UNC MPH-RD program, registered dietitian program, and just kind of playing around with different potential career paths. And I have this parallel track in my life of being really passionate about environmental causes, and like sort of interested in policy, but not really understanding what that meant. And definitely thinking politics is not for me, because politics is like cutthroat and competitive, and that's just not me. That's just not my personality. So grad school, I would say, is where things really started to crystallize for me. I started a graduate program that was, this is so far from maternal health, like it's kind of hilarious, but biodiversity, conservation, and policy. And it was because, you know, I've got this interest in environment, and I was thinking about like sustainable agricultural policy and climate change. And through that experience, I found out about an internship in my future boss's office, Senator Kirsten Gillibrand. She's a Democrat from New York, and she used to be my congresswoman. She represented the district where I grew up, and she was appointed to the Senate when Hillary Clinton was appointed to become Secretary of State. And so Kirsten Gillibrand was then a senator, and every senator, every congressperson has regional office back in the state. And they are staffed by mostly 20-somethings and interns. And so I interned as like a mid-20s-year-old person for free while I was in grad school on student loans. And so like there's privilege in that, right? Thankfully now there are more paid internships. There's been a big movement towards paying interns for their work, including on Capitol Hill, which is good. It means that there are more opportunities for people who do not have the financial means to, because really who does take an unpaid internship? So it was through that internship that I realized, okay, politics, not necessarily totally cutthroat, because it's maybe campaigns cutthroat, yes. Policy can be this really collaborative environment with bright, dedicated public servants who are compassionate and caring. And I realized that I really like this policy thing. And I worked my way up within Kirsten Gillibrand's office. Intern, a regional staffer. I moved, the big career move was moving to her legislative team in Washington, D.C., and that was a big leap. And working my way up from there, I focused on so many different issues because it's, again, kind of ridiculous. I worked on education, health, child welfare, environment, energy, postal issues. That was like my first leadership position, was working on U.S. Postal Service issues. I actually loved a lot of it. But you're a generalist. You're not diving deep into anything. You can't with issues that broad. So I actually just kind of followed where advancement opportunities were. But working for the person that I did, Kirsten Gillibrand, is a mom, relatively young kids, a woman in the Senate when it's only 20% of the Senate is women. And so all of her staff, no matter what issue area you focused on, issues impacting women, children, and families. And then I had a baby myself. This seems to be a theme among our panelists today. I had a baby, and I'd always cared about, like, I think I was initially drawn to like reproductive health and reproductive justice. And when I had a baby, that stayed, but morphed into, okay, I am interested in maternal health. And my personal life, I also wanted more balance, because working on Capitol Hill, your job is your life, and there's not much room for anything else. And so it was at this point that I made the decision to move off the Hill and move to the organization where I now work. And how it happened was, so maternal health was really starting to bubble up in the media, and abysmal maternal mortality rates and racial inequities. And it was that media attention and the drumbeat of advocacy got Congress's attention. And so Senator Gillibrand, I was then her health LA, said, I want to do what I can legislatively. Can you look into like some different options for, what I can be doing? And so I called what you do is you call a bunch of experts, because I wasn't an expert. And I ended up being lobbied by connecting with my now boss. She had just been promoted. Her former position was open. I had just had my baby. Working for a nonprofit offered more family life, work-life balance. And it gave me a chance to still stay adjacent to Capitol Hill and policy, which I love. And so that was really my very circuitous path to the position that I once never knew existed, and now am so grateful to be able to work in.
Wow, thank you all for sharing your own stories as well. I really do appreciate that. Yeah, I love that something y'all highlighted is that kind of the field of maternal health and public health is just, there's no set plan, one set path to a career. And so I know for me, I'm kind of just going with the flow and seeing what I fall into. And it sounds like that's a common theme that's kind of happened. But yeah, thank you so much again. We're going to move into question 2, which is, how is your current role used to support maternal health initiatives? So going more in depth about what exactly you do on the day-to-day would be great as well.
I can start us off again if we want to go round again. So yeah, I mentioned that I'm the evaluation manager of MHLIC. So for those of you who aren't familiar with MHLIC, that's Maternal Health Learning Innovation Center that is hosting this symposium. And we're housed at UNC with multiple partners in Georgia and DC area. And we provide a lot of technical assistance and training around maternal health and equity nationally. And we host a National Resource Center that Kelli is our leader of. And so we have a lot of resources out there, and we do also provide technical support. So in my role as the evaluation manager, the way that I support maternal health is by supporting MHLIC to measure and track like what we are doing on a daily basis, whether it's offering webinars or making one-pager fact sheets or finding more resources to host on our resource center. We also have 3 different cores, we call them. It's just like 3 different areas. It's policy, as Alyson mentioned, she co-leads the policy core, engagement of communities and providers, and innovation support. And so those are sort of 3 main areas that we work in. And as the evaluator, I am trying to capture all that we're doing. For one, to report back to our donors to say, this is what we've done with the money that you've given us. Now, HRSA is our donor. But also just to make sure that we're doing what we said we were going to do in our grant, but even more importantly, just to make sure that it's helpful to people, and so that those resources are getting out there, people are using them. What do they want more of? What's not helpful? When we have speakers and webinars, we try to evaluate those to get a sense for, was this a good use of your time? And do you like speakers like this, or would you like speakers about something else? So as that kind of center, we're providing assistance and education, both to if you listen to one of the earlier sessions, they talked about there's 9 different states that we work with a lot, and 3 rural areas. So those specific states we work with more intensively, but then any maternal health stakeholder in the US can reach out for assistance or resources. And so we're trying to tailor that for what folks actually want. And so hearing from those communities and those providers. So that's sort of what myself and Adriana works with us on the evaluation team, and a couple others, trying to both evaluate our own services and then see what the impact is. Hopefully, you know, like in the bigger picture, how is that technical assistance helping folks down the road? So that's sort of on the day-to-day how I support maternal health. I'm not like providing services, but I'm helping. We're a little disconnected from the front lines of like actual healthcare services, but we're helping support those providing healthcare and those who are supporting them. So we're sort of like removed from that, but that does feel good because I get to feel like I am helping move things forward, hopefully in maternal health, so that I can use those like more unique skills I have in this way to feel connected to the work. Off to you, Kelly.
Okay. So in my work as communications manager, I'm pretty much the person who does all the social media posting. I will say I help or edit blog posts. I do a lot of design work, a lot of beautification. Sorry, I saw myself freeze. Am I okay here? We're good. Okay. So, but in communication and marketing, of course, there's a lot of storytelling, well, some storytelling that kind of goes hand in hand with Abby's work with evaluation. It also goes along with Alyson's work in policy. I pretty much am the person that you throw all your stuff at, and then I try to get it out there for you, if that makes sense. What some of my responsibilities include keeping our branding in alignment. That includes like not only visually, but also our voice and making sure that we're inclusive in our words and just I just read Alyson's comment. Thanks, Alyson. And I help with disseminating activities such as like reports. So if you go to our website, maternalhealthlearning.org, putting a little plug in there. There's right now a section called telehealth, and there's a report section. And so you see all of these reports with all this great information. And I didn't do all that typing, but I did make it look nice. Okay. So I'll keep that as like in a nutshell, but a lot of my work does involve just keeping things nice. Thank you, Abby. Keeping things nice, keeping things in alignment. A lot of and just a lot of activity dissemination. And now my doorbell's ringing, so I'm going to mute and pass it on to Alyson.
Absolutely. So my role to support maternal health initiatives, I'll talk about kind of two separate roles. So there's my role with the organization that pays my paycheck, AMCHIP, the Association of Maternal and Child Health Programs. And then as part of that job, I have a role with the Maternal Health Learning and Innovation Center on their policy core. So in my day-to-day work with AMCHIP, I'm one of two members of a government affairs team. Our organization is about 40 people total. So advocacy and lobbying is just one part of the work that our organization does. My biggest job is to make sure Congress is thinking about and supporting and promoting policies and programs that improve maternal and child health. So it's broader than just maternal health. It's cutting across MCH and the lifespan for those populations. And AMCHIP is a membership-based organization. So our members are folks typically in state health departments who are administering statewide public health programs focused on improving maternal and child health. And the biggest backbone source of funding for that work is something called the Title V Maternal and Child Health Services Block Grant. And the reason that my job exists is to make sure Congress gives that enough funding, and ideally increases that funding. So I'm a registered lobbyist. That means, you know, I tell the federal government what I'm advocating for, and I'm very transparent about that. And I feel really good about having my job basically be a professional advocate for that program, as well as policies that support maternal and child health. A lot of it means working in partnership with other organizations who share similar mission and vision to AMCHIP and our members. And it's also being responsive to, so there's a ton of congressional interest right now in improving maternal health, which is great. It needs that spotlight, and we want to hold on to that spotlight as long as we can and get as much done and as much federal investment while we have congressional attention as we can. So that keeps me really busy, making sure that when a congressional office thinks of maternal health, one of the resources that they think of is me, that they can reach out to me for information about state health department work on maternal health, and use me as a resource for learning about other individuals and organizations that they should be talking to, especially where AMCHIP is not an expert. So I see very much that as my role. It's also making sure that I am communicating back to our AMCHIP's members and state health departments what's happening on Capitol Hill, so that they're informed about things that will affect their work to improve the health and well-being of these populations. My role with MHLIC is, first of all, Maternal Health Learning and Innovation Center, it's a national resource center that's funded by federal dollars. And I have advocated for that funding and continue to advocate for that funding. That is separate from this grant-funded work from the government. So my job in promoting maternal health through the Maternal Health Learning and Innovation Center is lifting up promising policies at the federal level, the state level, the local level even, for any and all maternal health stakeholders to learn from and share and contribute to. And so it's providing, my role is helping to provide policy leadership for this National Resource Center focused on maternal health, and particularly promoting equity within maternal health outcomes.
Wow, Alyson, thank you. That kind of just leads right into our next question. So the next question is going to be focused on what methods do you use to implement equity throughout your role and your work? And so we know equity is a huge, huge thing right now that, of course, maternal health, you know, that's needed to help eliminate all of these disparities that people are experiencing, especially with MHLIC's work and working with severe mortality or severe maternal morbidities and mortality. So yeah, if anyone would love to answer, y'all can continue to go in the order that you'd like. But yes, thank you. Now I'll put the question in the chat.
Thanks, Siani. Another great question. Yeah, I can get started again. So as an evaluator, I think that equity is like fundamentally important to think about, because as we're gathering and sharing information, we need to think about where that's coming from and where it's going to and who's using it and who's giving up their data. And in thinking about what we do, it's important to be part of the process at every step. And I think that's done better in some places than others. You know, I've learned a lot through working with MHLIC and just through my career of seeing things done well or better and things not done very well. And I think engaging folks in that process is one of the best ways we can do that for evaluation. And so depending on what you're looking at, what you're evaluating, trying to engage stakeholders at every level, including people with lived experience, to be helping guide that process of developing an evaluation plan and data collection and thinking about where the data is coming from and how that might impact the results, and also the interpretation, making sure the interpretation is not just me as a academic researcher looking at the data, but thinking about hearing the voices from those folks who shared the data, and thinking about more the role I have at MHLIC, where we're not collecting data from patients or people who are in the healthcare system directly. Most of our data is coming from like people like you, who, when you finish with the symposium tomorrow, hopefully you'll take our evaluation survey of what you thought about the symposium and share your feedback. So we're gathering info from the people that we provide webinars and training to. So we do try to think about that in our questions of looking at how the information might have been received by different people, or what other resources we can provide. And we have like an evaluation stakeholders committee that we have convened to try to give us feedback on our evaluation questions and what we're thinking about or what we're looking at measuring. And I think evaluation can also be used to hold people accountable, to show them the data. This is what the data are saying, this is what people are wanting, or this is how they felt after this training, for example. And helping us think about how equity is situated in all the rest of the work we do, as far as if we're developing materials or trainings, as that's on our work plans. With part of the way that we structure our work plans, there's a space to like try to encourage people to think about how is this document or webinar going to center equity. So asking those questions to help people think through it and make sure it's included. Yeah, so I think that's sort of where I'll start. I'll think about, I think somebody had a question for me too. I'll look in the chat and you can come back to me. I think it's Kelly's turn next, or Alyson, if we want to break up the order.
We can keep it going. Okay, so as far as equity goes, that kind of, or it does go hand in hand with disseminating or distributing graphics and creating content in general. So sorry, I wrote this down, so forgive me while I look down, but so my role calls for a complete look at the landscape and to make sure that there is representation, while also remaining in alignment with the missions brand, the brand and the mission of MHLIC. So for instance, I'll just use like, I don't know if everyone saw the video that shows right before the slide deck where it's welcome to MHLIC, or it's the purple, the logo, all that. So throughout that video, you see representation, different cultures, different parenting situations, and that's us communicating, or displaying equity. And really, my answer is pretty short. And that's literally because everything that you see across our social media, across the website, our presentations, even in, for instance, I had to create a slide deck for like a master slide deck and provide images to pull from. And in those images, you see different cultures, different, or people who identify differently. And that's part of equity, is just equal representation across the full spectrum, and in inclusion and diversity. To me, it all goes hand in hand. And being able to communicate that visually and also linguistically is part of the communications job that I hold. Alyson?
Thanks, Kelly. So in terms of implementing equity, I'm going to talk about my two roles again. So at my role at AMCHIP in government affairs, we, and actually organizationally, AmChip has made a public commitment to anti-racism and racial equity. And so we are, as an organization, in the process of proactively infusing equity in our processes, policies across the board. And that includes how we review policy, like legislative policy, not just our internal organizational policies. And so for the first time in 2021, our federal policy agenda includes a statement at the header that says we are committed to promoting racial equity and health equity, and using a racial equity lens in reviewing policy, and declaring racism a public health crisis. So, you know, that's a statement at the top of our, you know, one-page federal policy agenda. Okay, so what does that mean in practice? Well, we hired an intern in the spring semester 2021 to help us create a framework for reviewing policy using a racial equity lens. Lauren Battle was our intern. She's a phenomenal recent MPH grad from Columbia University. She's now headed to Capitol Hill for a health policy fellowship. And she developed a framework for us to use in our day-to-day work that we are in the process of implementing. For now, it's an internal document that we want to like work through and figure out, like, what does it mean to use this every day? We hope at some point in something that we could share and have other organizations perhaps implement it as well. And so that's the framework is a series of questions that we, our government affairs team, ask ourselves as we're reviewing policy to better understand the racial equity implications of a given policy change or federal investment. I also sit on our internal equity committee at AmChip. So that's a staff committee that's really thinking through and working through how we infuse equity into our organizational policies and practices, which has been really interesting and fulfilling to do. At MHLIC, the Maternal Health Learning and Innovation Center, trying to be, so I feel like if you're not intentional about equity, it's just, it might not happen. And so I was asked to work on a policy plenary for the symposium, which is really broad. And the title for the policy plenary tomorrow is leveraging policy to achieve maternal health equity. And so as Abby mentioned, like being intentional about having the equity implications in the organizational work plan is really important to systematize infusing equity. And I wanted to make sure that the policy plenary wasn't just like had equity as an aside, but it's the whole thing. That's what our amazing speakers are going to be talking about tomorrow. So this is just it is so critically important to have this be the center of work when we're talking about maternal health. And there are so many ways to do that when thinking about policy change.
Thank you. We're getting short on time, so we're kind of, for this last question, we'll kind of do a little fire round. But the next question is, how do you use creativity in your career? I know, Abby, you're creating questions for people. Kelli, you're merging the health content and also disseminating to, you know, the masses. And Abby, and Alyson, I'm sorry. I know that you're also, you know, helping with policies, and that's a lot of creativity as well. So yeah, a little fire speed round would be great. And yeah, thank you.
Yeah, I think just quickly, I think it's important to use creativity when sharing data and results, because if you don't use creativity, people's eyes will just start to glaze over if they're not like a data person. So trying to use the data and evaluation to tell a story, or have you know, interesting ways to present it and connect it to the people and the reason. And sometimes that takes a lot extra thought and creativity in translating that. And so I think that is one place where our creativity is really important in evaluation data. So it's not just slides and slides of boring numbers.
And Siani, you hit the nail on the head. Right. My position just calls for it. It's probably in one word, or two words, be creative. So really, it's just the gist of the job, for lack of a better way to put it. So I'll go ahead and pass it to Alyson.
So I don't get to be creative so much in the like visual sense. I just call Kelli for that, or send content to Kelli for that. But there is a lot of creativity, to Siani's point, in legislation, like coming up with the legislative text so you can get buy-in like across party lines, or working with partner organizations and figuring out, okay, what can everyone agree to, so that we can actually move this as part of legislation. The other part of my job where I get to be creative is writing for like a lay audience. So someone who isn't myself reading policy stuff all day, every day, essentially like translating that into words that are going to resonate with people that are not, there's a way of speaking in Capitol Hill. There's even a phrase for it, inside the Beltway. And it can be very inaccessible. And so I see a lot of my job as being able to take policy and what's happening in DC and put it into terms that is interesting and accessible for anyone who's interested in policy.
Wow, that's great. I've never thought of that. That's really great. So we're going to go ahead and transition because we want to make sure there's time for you all as the audience to ask questions if you have any. So we're going to transition to a quick Q&A. Adriana who is also working with MHLIC, is going to lead this. Thank you, Adriana.
Okay, so I am going to go back. Somebody asked a question earlier. I'm trying to scroll back up and find it. Let me see. The chat is so long. Okay, yeah, so I have the question. So one of the, I think Dominique is their name. They asked, what does your typical workday look like?
Was that directed at anyone specifically? Do you remember?
No, it was just a general question.
Well, since I unmuted, now I guess well, in this day and age, as you probably all imagine, we sit at a computer a lot, sometimes stand at a computer, sending emails, drafting evaluation surveys for our various trainings or events. And one other thing I do as part of my job is host a community of practice which is like a group of shared learning for people who also work in data epidemiology in our the 9 states that we work in. And so coordinating that, and that's a really fun one because it's like peer-to-peer learning. So a lot of emails, thinking through questions and what we want to measure, what we want to be able to show, and occasionally doing data analysis and qualitative interviews, that kind of thing from my side.
A lot of my day, it really consists of social media monitoring, website updating and maintenance, a lot of design work, curating content to be distributed, and it also includes receiving content across the course, and because every core has like their own scope of work. So whatever work they come up with, I receive it to edit, beautify, and then send it on out to the masses, so to speak. So I would say in between running behind 2 toddlers and and ringing doorbells, I do a lot of, just as Abby and Alyson may hint to as well, behind the computer and working.
So my job during pandemic times is very much in front of this screen, and it's a lot of monitoring incoming email and hopping on Zoom calls. But the content of that varies. So the monitoring email, it's sifting through a lot of different incoming information from news outlets, from announcements from Capitol Hill, emailed questions from congressional staffers, from partner organizations, and kind of just synthesizing a lot of information and then continuing to report that out to AmChip's members, working collaboratively with partner organizations. So like joining onto sign-on letters to members of Congress or congressional leadership, reviewing legislative text, drafting. So like I just did a blog post for maternalhealthlearning.org on what's happening with postpartum Medicaid extension at the state and federal level. So just like putting together a bunch of information of what's been happening. What else is day to day? So it used in pre-pandemic times, and maybe I hope again someday, a lot of my day was outside of the office. So it was going to meetings on Capitol Hill. It was going to partner organizations for coalition meetings in person at a table when we still did that. And meeting one-on-one with people for coffee. So much of government affairs is about building relationships and building trust. And I can still do that over Zoom, but in pre-pandemic times, that very much was, there was a focus on in-person connection. So, you know, it's been a transition, but the day-to-day, I do a lot of talking. I will say that talking is a big part of my job, and listening actually. So it's a good thing to break up, you know, the constant just email traffic and following news on Twitter.
Great. Okay, another question from the attendees. Somebody asked, how would you all like to see the MCH field transform in the next 1 to 2 decades? And this question is for anybody, so anybody can jump in.
That's a really big question. And as a policy person, I don't feel totally confident responding to it, but as someone who I still feel like I can call myself an MCH person, even though I, you know, come from a non-traditional background. I will say, representing MCH folks in state public health, I think that right now everyone is just being so stretched. And there is burnout, there's going to be burnout because of, I mean, there were stressors before COVID, and this past 18 months has just rocked the public health workforce. My goal and my hope is to utilize this moment where public health is in the spotlight to make sure that Congress invests in public health so that we can grow the public health workforce to what it needs to be, and invest in workforce in terms of having diversity match, you know, the full population of the US, and really build out the supports that the public health workforce needs to, you know, be the best in the world in serving our country and the health and well-being of our population, and MCH in particular. So I'm going to take on that job of making sure Congress gives the funding that, you know, state, local health departments need within MCH. I'll let Abby or Kelly add anything else about the next 1 to 2 decades. Small question.
Yeah, I would say if as a person outside of the MCH spectrum, I would say I hope that there's more listening, more being in tune with people who are not necessarily of the same culture, if I'm making sense. As a communications person, I would say that I hope that in the next 1 to 2 decades that, and this is me imagining, but maybe telehealth, not telehealth, excuse me, but maybe our media takes a better role highlighting the good and not necessarily all of the bad, if that makes sense. There is good media out there. There are good highlights. I recently saw something from CNN highlighting some of the work that MBEC is doing in hand with Representative Alma Adams, I believe her name is. Thank you, Alyson. I see you nodding. And but they're doing great work. We need more good stories like that. We need more. We need to highlight more about pretty much the good that's going on, and hopefully one day that good outweighs the bad, if I'm making sense.
Yeah, definitely. Yeah, I'll continue on that sort of listening theme that Kelly started. I think that my dream for a decade or two from now is that we listen to women, that our medical establishment listens to women, particularly Black women. I, as somebody who is a white educated woman, I know I had trouble getting people to listen to me when I said something's not right, and they just sort of brushed me off and told me to relax. And a day and a half later, I have a 1.5 pound baby. And so I know that's hard for me, and that happens even more often to somebody who doesn't look like me. And so I think that that's what we need. You know, we need providers to listen to women, and that doesn't relate necessarily to my data and evaluation career, but that's would be my dream for a decade or two from now. And I'll do what I can in the data realm to share those statistics so that that does bring light to it. You know, I mean, I think the statistic that Black women are dying 3 or 4 more times likely has been finally communicated and is more well known. So that kind of information does draw attention to it.
Thank you, everybody. One last question, and we can do this one in a lightning round because we're almost out of time. What advice do you have for young professionals, or things you wish you knew you did or that you knew?
I'll actually go first on this one. If I could give any advice, I would say be patient with yourself. I'm a person who has a microwave mentality, and I haven't tried to change it, but I'll work on it, I promise. But you know, I think a lot of us nowadays expect things now, we want it now. And I think that it's important for anyone who is working toward any ultimate career goal to be patient with the process. That would be my advice.
I think that's great advice. I really like that, Kelly. I think as a student or as a young professional, one thing that I really valued was getting feedback from people on my work or on my presentations or stuff like that, that I think is easier to ask for when you're younger and a student, or maybe it's easier for people to give it to you, which sometimes is annoying as a student. But that's like when you've got that time and effort to sort of learn how to improve. And I think that's an ongoing process. And I think that as we continue to in our careers, we shouldn't ever stop asking for feedback. But so let's go ahead and get started now, I guess.
And I think don't be afraid also to ask for, used to be coffees, but now it's so much more accessible. Just ask for a meeting, a call, a Zoom with someone who has a job that you just think is really cool or interesting and you'd like to learn more. And, you know, I've been on both sides of those conversations. And as someone who takes those meetings, someone who wants to learn more about my career, it's really fun. People like talking about themselves and feeling like they have something to share and give. So don't be afraid to ask for those kinds of meetings.
Thank you. Thank you. Thank you all. Thank you to our participants for coming today. We really, really were happy to have you. And I hope that you were able to learn something new or, just gain something out of this experience. I do apologize. I did not have the live transcript on during this session, and we're all about inclusivity. I'm so sorry that I did not recognize that, but thank you again for just being here. And thank you to our esteemed panelists. It was a great session and your feedback was very valuable. And we're hoping that you enjoy the rest of the MHLIC Symposium. Again, there's some more things going on today and tomorrow. Some more workshops will also be taking place around the same time. So yeah, thank you all for coming. And we hope you have a great Monday.
Thank you.
Thank you. Thanks for hosting, Siani.
Yeah, no problem.